it's super important that the patient knows you're focused on them. That shows I am very focused on you. When you point to an area, can you point to the spot? And I step forward at you. That means that shows that physical movement towards you goes, I am engaged, I am focused. It's very aggressive, but in a very positive way. And you're basically saying to them, when you go, okay, where does it hurt? It hurts right here. I'm very aggressive. It's very aggressive because I'm moving towards you and I'm standing up over you. And you need to understand, I mean, we're all big guys, and especially if you're a female, it's super aggressive, but it's aggressive in a very positive way, and it gets them used to being around you. It actually will spike a hormone change, a tiny one, but we use that in a good way. So the main complaint, it's touch. And the other thing too is the worst thing that can possibly happen is the patient leaves thinking he doesn't have a sense of what's wrong. They need to understand, I know what's wrong with you. Otherwise what happens, and I didn't realize this early on, but if you are not crystal clear and they don't think you're crystal clear about what their problem is, they keep bringing it up. Like I have patients go, okay, so the pain, it moved a little bit, it's right here, or it's right here. And they want to review their symptoms with me every time they came into the office, which is extremely tedious and tiring. They constantly want to revisit it and talk some more about their symptoms and go over their symptoms. Why? Because they love talking about themselves and their symptoms. This shuts it down. By touching it and saying, right here, I know. And they go, you know what's wrong. They stop doing that, and it creates, it's too much time, okay? Any other questions about the main complaint? So, we got the main complaint, now you're gonna go into the OPQ or ST, right? And this is, you talked about, can I do it in this format? I have a format that's designed for speed and thoroughness, and it works really good. And it prevents them from rambling and allows me to rapid fire questions. And I love rapid fire questions. It's generally impressive because they usually haven't put this much thought into what? Do they stop and go, on a scale of 1 to 10, how bad is the pain? Is it sharp, achy, or burning dull? They don't think about those things. They just know it hurts. Does it hurt all the time or part of the time? That's a big one because they go, huh. Now some people go all the time, but other people go, I guess it does hurt all the time. That's increasing their reality. So we're doing a couple of things here. One is, I always say increasing their reality, waking them up to the truth. This is like religion. I gotta wake you up to the truth. You need to understand how pathetic you are. You need to understand how lost you are, and without Jesus, you're gonna go to hell. I gotta wake you up because you don't get it. And this is where you can affect the minimizers. See, what happens if you try and change someone's paradigm? Do they like it?
No.
Yes and no. So the point of the paradigm shift that you're actually trying to do here, keep this in mind. Again, this is active listening. You start gently waking up their reality. Dude, you're a freaking mess. Did you like it when I woke up your reality about having a bulging disc in your neck?
No.
Not at all. Especially because why? Why didn't you like? I could tell you that I annoyed you. You did not like me because I did that, right?
In a way, yeah.
In a way.
Yeah.
But not really, because you're like, okay, he's just, but here's my point. Why did you dislike me? I want you to understand why you disliked me.
Because I didn't believe it. And you're trying to impose something that I don't believe on me, I guess. So
Yes, exactly. I smashed it on you. In front of other people, I crammed it down your throat. You remember that?
Yeah.
I used 3 or 4 different techniques. I used peer pressure, I took x-rays, I jammed it down your throat, and you just went, okay, I believe you. Now I'm highly annoyed. You don't want to do that to your patients. You have to do it gently at their own pace. You're looking for minimizers, you're looking for obstacles, you're trying to wake. This is where you wake up their reality. You ask them on a scale of 1 to 10, how bad's your pain? They go a 2. No, that's a bad reality. Why? What do we know?
Just to come in, they have to be at least 5.
7. The average is 7. You're right, they usually are at least 5, but the average patient that comes to you is 7. So I'm gonna stop and start asking, even getting uncomfortable. Am I willing to get a little uncomfortable? To get him to put a pink shirt on, I might have to nag him and be a little uncomfortable. So it's a balancing act. I gotta be comfortable enough to get the information that I need without super annoying, right? This is why you have to role play this. And you have to role play it again and again and again and again until it starts to get comfortable. Because the better you are at this, if you did these two are easy, this, and then boom, boom, you're trying to hit all these points. You want to get 2 or 3 points in the OPQRST. So one of the points you're trying to get is you're going to get a point for your thoroughness. You're asking questions they haven't even thought of about their condition. You get points for that. So you get 1 point. That's a plus 1 point. Then you kind of wake them up to their reality. Oh, your pain is constant? Does it ever go away? Well, I feel good sometimes. Does it ever go away? And this is the phrase I use. I go, so are there ever times where you go, man, my back feels amazing. I can lift, I can do whatever I want. And they go, no, it never feels that good. So there's a small degree of pain there all the time then. Yeah, I guess there is. I just woke them up to their reality. Now they may not appreciate it, but I increased their awareness a little bit. And I showed them, I figured out something about your condition that you didn't even know. And that's why at the end when I do the summary, they go, you know more about my problem than I do. That is the ultimate win. That's the admission that, wow, you're amazing just by asking questions. You've already scored a ton of points, right? Then the third thing you're trying to do, so you're trying to show them how thorough they are, wake up their reality a little bit, change their paradigm a little bit. There's some really useful things you can do here, and they like it. Any questions about that? The order, just so we're clear, is you always start off with, you always ask them the severity. Is it mild? So what's the steps again? You guys might have to remind me, but it's mild, moderate, or severe. Right? And then you do 1 to 10. Why do you do both? Aren't those the same thing? Because you're looking for consistency. They'll say, oh, it's mild pain. 1 to 10, how bad can it get? 7. Well, that's not mild, is it? That's severe, right? So you're looking for consistency. If it's less than a 7, I'm going to question them. I'm going to challenge them. Okay? When it's at its worst, how bad can it get? You saw Tanner, he wouldn't go over a 3, right? So I challenged him, and he goes, no, it's always a 3. It doesn't slow me down, doesn't interfere. I don't ever take drugs, right? So you're waking it up, and then after that, what do? I always go to constant or not, right? After that, I do the achy, sharp. This one's a menu.
Put your frequency in there too?
Constant.
Constant.
Duration?
Yeah, so I just go, is it constant or intermittent? And then if they go, oh, it's constant, that means all day, every day. So, and I would clarify, so if they go, is it hurt a lot all day, every day, or a little bit? Most of the time, so yeah, I'm gonna do a bunch of follow-up questions, but this is the duration and frequency. But I'm trying to get them to say it hurts all the time. That's what I really wanna know. Does it hurt all the time? Does it hurt a lot all the time? Is it mostly a 7? Or is it mostly a 2 with a few flare-ups into 7? That's important information that I gotta know. Okay? And then after we go achy, sharp, dull, right? What's the next thing we wanna know? Does it radiate? Right? Anything else? I don't think there's anything else, is there? These are the big things. Remember, we're trying to build towards need. Need is the most important thing you get. So that's when we're gonna go next, is to its own category and which activities make it better or worse, right? And this might be specific activities. When I bend over, it hurts. When I lean backwards, it hurts. When I pick something up, it hurts, right? And then, so this could fit in with those, but the next one is need. And this is the most important, highest part. If all you ever got was need, none of that matters compared to need. If you do all these things perfectly and you don't get need, you're screwed.